Danielle.
And I'm Ashley Russell. I'm a pelvic floor physical therapist at CC's Physical Therapy.
Today we're going to be talking about the pelvic floor. All things about what it is, what it does, and who should be concerned. So, Ashley, tell me a little bit. What is the pelvic floor?
Great question. Because we use the word pelvic floor a lot, and sometimes we don't always be able to see what we're talking about. So the pelvic floor is a hammock of muscles that's within the pelvis. There's also structural ligaments as well. And what it does is it provides a lot of support for our bowel, our bladder, our uterus if you're a female, and just kind of helps hold everything because it is a muscle, or it is a group of muscles, so it contracts and it relaxes. It also assists in sexual function, voiding, and holding our bowel and bladder as well.
Perfect. Yeah. So we talk about pelvic health a lot with like females. Are females the only ones that should be worried about it? Who has it? What do they do?
So everyone has a pelvic floor, male and female. And in terms of who should be concerned about it, or maybe some things that cues you in on if you have something going on with your pelvic floor. If you're experiencing any fecal or urinary incontinence, meaning any leakage with sneezing, laughing, coughing, if you just can't hold your bowel or bladder, if you have a lot of strong urges, if you have pain with intercourse, pelvic pain, heavy painful periods, abdominal pain, back pain, hip pain.
So it sounds like there's a lot of symptoms that go along with it. So if somebody's experiencing some of those symptoms, where should they start? What should they do?
So the other thing that I missed was like pregnancy and postpartum, or even like pelvic floor heaviness is also another sign of any like pelvic floor dysfunction. So finding a local physical therapist who is trained in physical pelvic health, they can first do an assessment of the pelvic floor to see what exactly is going on, where's the source of the problems, because there are a variety of different diagnoses, or whether it's tight pelvic floor or weak pelvic floor or other things that could be contributing to that. Absolutely. So finding someone who can assist and diagnose kind of what's going on with the pelvic floor is the first thing. Okay. And then in terms of what we do as physical therapists, after we figure out what's going on with the pelvic floor, we can dive into all of our tools, whether that's looking into the hips and the back. We do internal assessments, we strengthen. So it's really tailored to what exactly that person needs.
Perfect. And you guys do all of that here at CC's?
We do. Yep.
Perfect. And what's your favorite part of treating pelvic floor? Or pelvic health, I should say.
Yeah. So I would say my favorite part is being able to first provide a space that people can talk about these things.
Absolutely.
Some people feel shame when they're talking about painful intercourse, or peeing their pants when they're laughing with their friends, or those types of things. So just providing that space of like, no, this is not normal, but you're in the right hands and we know how to treat those things. So I think just providing that space for people and being able to help people when they're like, oh, I just thought I was going to have to live with this. So I think that's one of my favorite things.
Absolutely. And I think that's one of the common things that we're definitely going to be addressing on Core Conversations, is just how some of these symptoms are normal, and that, people have all these symptoms and you're not alone. So, and I think that's really great. Yeah. So, we'll be doing these once a month. Next month, we'll be talking about Kegel exercises and the very controversial topic of them. So join us next month for that, and we'll see you next time.
Thanks.
Bye.